For those of you who don't know me, I'm Rubina and I'm with the academic team. I work for Aspen Dental Management, and we are the support organization, the support team for Aspen Dental for our doctors to do what they do best, which is focusing on patient care and practicing. So before we begin, there is a question and answer box on the bottom. So feel free to type in any questions you may have during this, and that'll allow Dr. Teskey and Jennifer to answer them for you. There are also questions that I had previously submitted in a Google form when you guys registered. So you will often see me looking here to look at those questions as well as the questions that you type in real time. So I'm not distracted or anything. I'm just looking at another screen. So there is also a raising hand option. I would just refrain from that since we can't actually communicate with you attendees. So the best option is just to type in your questions and we'll answer them accordingly. So without further ado, I'll have Dr. Teskey go first in her introduction, and then Jennifer right after.
Hi, everybody. Thanks for having me. My name is Allison Teskey. I graduated from Marquette University in 2008. I actually started off with another DSO prior to Aspen. Was unhappy in that position, that DSO. Aspen was fairly new around that time in Wisconsin. Not much media or attention was around it. Another doctor I had worked with had gone to Aspen Dental, and he said, why don't you try this place out? I love it. So I kind of threw caution to the wind and got a job with Aspen, started as an MCD in Waukesha, Wisconsin in 2010. And really never looked back. So 2012, I bought Waukesha. 2015, I bought my second practice in Madison. 2017, I bought my third practice. And then 2018, I bought 2 more. So I have 5 Aspens total in the Milwaukee, Madison market. And I love it. And Jen is my wonderful director.
And my name is Jen. I've been with Aspen since 2008. Started at the front desk in a position we call a patient service representative role. And I quickly moved up, being able to put my business management degree into practice, was an office manager, relocated my family to our practice support center in New York to join our training and development team. And I used to teach different classes that we would put forward to teach office managers how to be office managers. Also dabbled in some of our hygiene orientation programs as well as our doctor orientation programs. Then moved on to a regional position in Michigan where I managed majority of the practices there at one point in time before moving on to open up the state of Minnesota, and then finally settling into Wisconsin as the territory director.
Wonderful. Thank you for the introductions. Right off the bat, I had someone just ask, what are the options you had coming out of dental school? You did mention you went to another DSO. In the end, why did you choose Aspen? But I guess first, what did you look into coming out of dental school?
I was an assistant in private practice all through college and dental school. I knew that dentist I worked for, she had a really hard time running a business and having a family. So I knew going into dentistry, that was something that was very important to me. I mean, I wasn't married yet, but obviously that was something that was a big factor for me, was I wanted to be able to get married, have kids, and still be able to run my practices. She was not happy running a business. I didn't have parents that were dentists. I didn't really know anybody else that was dentists. So a lot of it was the business side of it. Aspen took over the business part of it and really allowed me to learn the business as I was ready to learn the business. And so I started out, like I said, as a managing clinic director. I probably wanted to be an associate at that time just because I didn't feel like I had the clinical skills, but they thought I was ready for managing clinic director at the time. So I jumped in, and I got in a little bit over my head at first because these are definitely faster paced offices than I was used to. But the last DSO I was at, it was so slow. I wasn't doing anything. I was doing some fillings here, maybe a crown there, some hygiene checks. It just wasn't I wasn't fulfilled as a dentist. And then when I came to Aspen, I really saw the amount of patients that we reached and the patient base that truly needed us. And you actually got to do dentistry and get patients healthy. And I'll never forget the first time I was like 2 weeks in and a patient looked at me and started crying that I gave them their smile back. And from then on, I was hooked. So I knew I was in the right place.
That's wonderful.
Yeah.
You did mention that you were able to learn about the business side. Jennifer, can you speak on that? Is that something you provided? Is it something, how does that work? How for associates or managing clinical directors, which are lead dentists for those of you that don't know, how does that work for you in your role?
Sure. In my role as territory director, I'm going to partner mostly with our owners to help them understand where their business needs are. But I have an entire team underneath me that helps our managing clinical directors and our associates to better understand where the business is going and different behaviors that can help drive the business. And we do that in collaboration with the owners to make sure that we're all on the same page. As part of the administrative team, I'm not a dentist, nor is my team that works underneath me a dentist. So we partner solely with the owners like Dr. Teskey to help drive that business and help you guys know where to go. We help you with all the business things. So helping you understand the behaviors and where the fees are coming from on different aspects to help you get where you want to be.
Yeah, they really help you look for patterns in the business, patterns in the market. They help you understand your acceptance. You know, if you're getting acceptance, you're getting healthy mouths and how that relates to your business. And really that's what it is. A healthy mouth is a healthy business. And so you got to get your patients to that point. And it's very simple actually. So, yeah.
Wonderful. So you're not coming in and saying, you know, doc, it looks like we need 10 more crowns this month. Is that something you're doing?
No.
I said business, but business is money too.
Yeah.
You know, people think about those kind of things, especially with DSOs.
Yeah, that is something that myself and my team never do. There is no quota. There's no budget to hit. There's goals we want to obtain to get in, because everything that we look at from a goal perspective just means another patient getting the care they need. But there are no quotas on how many cleanings need to be done or how many crowns or anything like that. That is definitely something that we stay away from.
A big thing they helped me understand was insurance. You know, how insurance works. If they pay for a really large surface filling on this tooth, you know, they're going to be less apt to cover a crown in a year or two if that breaks again. And so, you know, those kind of patterns that insurance are going to try to get out of paying, had you not just done the crown in the first place and done what's right for the patient. So it always comes back to what's right for the patient and with the insurance. And you just learn as you grow too, that, you know, patients don't want to keep coming in for visits on the same tooth. And so they kind of help you see that, but never quotas, never more crowns, never anything. It's always what's right for the patient by all means, and which means what's right for you and your sanity in the end too. So,
right. Going along with that, do you do your own treatment plans? Do you get to do procedures you want, I guess, when you first started with Aspen, or did the other doctor in the office? How exactly did that work initially? And I guess for me, I would ask a follow-up, how does that work for when you have associates come in and the training process too?
So I was the only dentist when I came in. So my treatment plan, I made the treatment plans, I executed the treatment plans. Obviously, the treatment plans change as you realize what your patients need and how you learn and you grow treatment planning, just like with any dental office. You learn what your hand skills are, what you're better at, what you're not good at. So obviously my treatment plans have evolved, but they're all 100% me. And I tell that to all my dentists. I say, listen, make your treatment plan may be different than mine, but you can also execute things differently than I can as well. So the route at which we get there might be different, but the end result always has to be a healthy mouth. So I make that very well known to all the dentists coming in. Most of my dentists, I shouldn't say that. Most of my offices are one dentist offices. So they're the dentists making the treatment plans. And at some point, I even work off their treatment plans. So they'll have a treatment plan. My MCDs will make it. They'll say, hey, doc, can you do the surgery for me? Can you do this crown prep? I'm sure. I'm here to help. It's a team environment. And we bounce ideas off of each other all the time. Again, it's coming to the best option for your patient and the best treatment plan for that patient to get them to healthy. So that was a long answer, but I make my own treatment plans. Yeah.
Oh, it's wonderful.
As do my doctors.
Wonderful. When you came in, or even now, did you have a mentor? Do you still speak to them? Did you speak to them often when you had one? Were they easy to access?
Back then, my mentor was probably Dr. Judge. I mean, who's obviously, you know, the head of our clinical team, because we were so much smaller back then. But another person I always went to was the other owner in Wisconsin. She was the first owner, Dr. Lays, Katie Lays. And we're still close today, and we still bounce ideas off each other. Everybody in the State's very close. There was this program at the time where we would all go to Syracuse, and a group of doctors would get together. I know there's another doctor in a couple other states that were close, and we bounce ideas off of each other. So yes, mentors. I would say it's more, I don't know if it's a mentor relationship now as it is just a colleague relationship that it's grown into, where we can really just be honest with each other. And either they're teaching me, I'm teaching them, but it's more a soundboard for each other. Like, is this right? Would you do that? Or so on and so forth.
That's great. Going along with that, I just had a question regarding any suggestions on how to choose a dentist to work for. Because during the interview, you can't really know if their working style is similar to yours. You may get more of a sense of that once you start working with them. So how to find that right person, that right match. And I feel like maybe both of you could answer that.
For me, I guess it's always just being open and honest, because that's the same fear for owners as it is for you. So if all of a sudden we get into it and our philosophies just don't mesh, I mean, come to us, come to the owners and let us know. And maybe we can find a different owner to work for. I mean, that's always a possibility. We never want to invest time in a dentist and then lose them. So Aspen knows we're all different and we all treatment plan differently. And maybe you would be a better fit somewhere. Jen, I know you would speak to that, where I've maybe had a dentist that doesn't work out, but we place them somewhere else and they've been very successful. I know that's happened in vice versa as well. So
I think it's important, like during the initial phase, just vetting out the interview process. We can do interviews like this via video, or we can do them in person. Don't be afraid to ask whatever questions on your mind. I can speak to my doctors here in Wisconsin, but I've also been part of other states and I've been with Aspen for a long time. I don't think any one of our doctors are going to shy away from telling you the cold hard truth about how they feel. They're very transparent. I think that's, as an organization, we try to be very transparent. Sometimes too transparent maybe, but we want you to know everything that there is to know. And we want you to feel just as comfortable with us as we are with you. In the event that a doctor does start with us and for some reason it just doesn't seem to click, we now that we've gotten to know you, myself personally, I know all of the owners in Wisconsin, so I know what their personalities are like. So just because you don't work out with Dr. A doesn't mean that you won't be a fantastic fit for Dr. B and that team. So we can move things around. We've done it before and it's been very successful. At the end of the day, we just want you to feel supported and comfortable, because that's the only way you're going to take care of our patients.
Great answer. Thank you for that. So this was posed: if I start as an associate, how quickly can I become a lead dentist at Aspen Dental? And then I would like maybe a follow-up with that on what was your journey your rise to becoming an owner? How did you position yourself to get you where you are?
Good one.
I start all my dentists as associates. I think it's the right thing to do until, again, we both get to know each other and we figure it out together. So my dentists start as associates, and then we hit targets and goals. My goal for you in the beginning is to just get comfortable with the dentistry and the speed and the flow at which these offices run. And the rest is really up to you. I mean, the quicker you pick it up, the more you want to do, the more questions you ask, the more interactive you are, the faster it happens. But it's very self-driven. I mean, I'm not going to do it for you. That's something that somebody really you have to be very self-motivated, and there's got to be a drive to want it. And I'll help you get there. I say to all my dentists, if you want to be an MCD, I'm going to get you there as quick as I can, but it's still up to you in the end. Same with being an owner, or a partner. Listen, I'm going to get you there as quick as we can, but this is how we have to do it. And then we set goals, specific goals, perhaps where you're struggling or perhaps where you need help. So everybody's different. I've had dentists go from associate to MCD within 2 months. I've had them go from that a year, or anywhere in between. So, and some of them they just want to be the associate. They just want to come in, work, see patients, and go home. They don't want anything to do with the business, and that's fine too. We need those as well. So, my path was, like I said, my path was a little different because it was 10 years ago now, and Aspen grew exponentially. Back then there was only like 50 owners, and now we have, I don't know, almost 200, right? So, it was kind of like, Allison, you're doing great. You want to be an owner? Here's some metrics. Here's some numbers. You understand them. Here's how we want to grow with you. And you want to do it? I was like, I'm in. But it's a lot more involved now. There's a lot more, I want to say, goals. And Jen, you can speak to that obviously better than I can because, yeah.
It ultimately, when you do join us as an associate or a managing clinical director, to get you to the path on ownership, obviously we provide several learning courses that can help get you where you need to be from a leadership standpoint, because as the owner, you need to help us lead that team. But we also want to set you up for success. So we want to be, again, very transparent, show you the financials, show you what it looks like to be a successful, profitable owner. And we want to make sure you can get there before we just throw you in there, because the last thing we want is for you to be upside down all the time and then leave. So we want to set you up and get you to those goals. It's all about goals and communication.
Yeah, I got thrown in, but I got thrown in the year because I was planning a wedding. I was getting married that year. I think I got married in May and I bought in August. And
Oh my!
It was crazy. But it was fun, and they really did. I mean, it wasn't just my director helping. It was every level director, and back then Jen wasn't my director, but it was every level from my regional manager to my director to their vice president to everybody in Syracuse. There's a whole team that goes over it because they won't have a job. That's their job, is to make you successful and make you happy. They don't want people buying in and then selling out. You know, that's not what they're in it for. They want a partner that's going to be in with them for their career. And so they're going to do everything they can to help you achieve those goals, as will I. I mean, that's part of our job as Aspen.
Right. So full support. You know how Bob, our CEO, talks. It's a marriage. Well, first you get engaged, and then it ends up being a marriage and all that good stuff. So it seems like it really is, from what you guys are talking about in your examples.
Yes.
Now, Jennifer, do you ever have situations where instead of talking to the POP, an MCD or an associate comes to you directly about their career path, or maybe they have talked to the POP, I'm sorry, everyone is the owner doctor. Have you ever had situations like that?
Yeah, of course. Not in the state of Wisconsin, not all of our offices are owned by what we call a POP, which is the privately owned practice, which is what Dr. Teskey is. Sometimes we have larger group practices where Dr. Judge owns a few of ours, so he kind of depends on me. So the doctors can come straight to me and talk. Ideally, they've got a strong relationship with their regional manager who they see more often, and then they can communicate with that regional manager, and then we get involved and we talk through it. Again, all about communication. I reach out to all of my owners quite frequently, and as a regional manager, you're talking to your associates and your MCDs all the time, hopefully weekly, if not more than that. So we also go through every month and sit down and talk with all of our associates and all of our doctors to help them understand how they get paid. And we talk to them a little bit about what their growth, what they want their growth plan to look like, where do they see themselves in a few years. So we not only will we identify and tap into it, but hopefully the associate and MCD are engaged too, and they want to be more and have questions. Back to the whole transparency thing, we're not afraid to answer the questions. You just have to throw it out there sometimes.
Yeah, none of the owners are going to get upset if one of their doctors wants to be an owner. Most of us are going to help you achieve that goal, because the more strong owners we have, the stronger of an organization we become, and we're pretty darn strong. So, I mean, obviously we want to keep that going. So, owners, doctors are very, very supportive of their other doctors. We're always looking for partners to share the load. Or like I said, just strengthen us as an organization, for sure.
Definitely. How involved are the both of you with the hiring of staff, hygienists, front office?
Jenny,
well, for me and my team, 100%. We actually have weekly, sometimes bi-weekly calls about recruiting needs. At the end of the day, our job is to make sure the doctor is supported. Our doctor can't be supported if they don't have the right staff underneath them. We're all human, so sometimes mistakes are made, and we never see the third page of the resume right up front. So we do have opportunities to learn with our teams, and we're providing constant coaching and development with the support team as well, from dental assistants, front desk, office managers, hygienists, lab techs. We have on-site labs in all of our practices. So we have the ability to continue that training and development. I personally love it when our doctors get involved in the hiring process. And the more the doctors involved, the better, because they're going to be working with that person. I have some doctors that don't want to get involved, and that's fine too. So that's what we're here for, to take off that burden. But you as the doctor, you can be as actively involved in that process as you want. We do that with all hygienists, doctors, dental assistants, lab techs, every different position.
We have a great team. Jen has a great team, hygiene recruiting team, lab. Our regional manager, Megan, does a great job sourcing. I used to be very hands-on with the interview processes, which I have now backed off. Because my personality is different than my doctors that are running the offices. So just like Jen said, I want my doctors in the interview more so, because they're the ones that are going to be working every day. I get to just come in a day or two a week, have some fun and leave. So they're going to be in it. They're going to be the ones getting to know these team members the most. So I've stepped back a little bit more now. And handed that off to my doctors a little, if they want. So
associates can sit down, because it might be their DA or their hygienist they're working with.
Absolutely.
Wow. Okay.
We encourage it.
That's great.
It's not required, but we do encourage it.
That's great.
And we'll have a dialogue. We'll say, what didn't you like? This is what I saw. This is what I didn't see, and so on and so forth too. So we like to have conversations about that too, just because hiring is a tricky part of business, and you pick up cues in the interview process the more you do them. So, we try to help the new doctors learn those cues too.
Definitely. Along with that, what do you look for when you're hiring an associate?
Personality and drive.
Yeah.
Simple.
Great.
Because I don't know how your dentistry is. I assume you know how to do dentistry. And just like you guys were saying, what if personalities don't mix? What if you can't do dentistry? I don't know. So my goal obviously is somebody that's got a great personality and has a drive to learn is easier to coach and more open to ideas and feedback than somebody who's really not. It's just how it is. So that's really it. You'll be the worst dentist in the world, but I have the best dentist personality, and I'll probably hire you.
And Jennifer, you're involved in that?
Yes, I'm involved with every doctor interview. We do them together. I've never made a dentist hire without one of my owners side by side to make that decision. Again, you're the doctor's employee, right? But yeah, I agree with Dr. Teskey. Personality is everything. You have to be happy with what you're doing, and vice versa. We can teach you the skills, but and behaviors, but we can't teach it to be fun.
Yeah, definitely. So Dr. Teskey, do you work or are you practicing clinically, or are you just admin? What exactly is your day-to-day look like as an owner?
So I work, yes.
Yeah.
I didn't actually work today, so I just don't want to get called out on that. I didn't actually like pull any teeth or do dentistry today. It was more admin. But for the last 10 years, yes, I have been chairside with patients, depending on the need. As I start to, if I lose a doctor, I fill in, or if a doctor's on vacation, I'm right there chairside in the thick of it. As we start to grow the practices, which is kind of the phase we're in right now, where I have doctors in each offices and now we have to grow the team in the business, I take a step back and make sure the doctors are comfortable learning the business, growing the way they want to. And then we're getting back to adding more staff so I can be chairside with patients doing surgeries and crown preps and implants and whatever it is that my MCD tells me to do.
Wonderful. A student just posed the question, should I go into residency? Do you feel like Aspen gave you enough support to not go into residency? And I know you had a different pathway, but maybe you could speak on some of your associates and their pathways, or also Jennifer, anything you've seen from doctors you've worked with?
I hate to say yes or no one way. I've had really strong doctors come out of dental school and do just fine. But I've also had the opposite where they struggle. So again, it's not more so if they do a residency. It's more so about their attitude and willingness to learn from you, and almost humility that you don't know everything yet, and you're open and willing to do whatever it is I teach you or want to teach you. So that's a really hard question to ask, but do I think Aspen provides enough support? Absolutely, to go into this without a residency. Do I think it's everybody's path? No.
Oh, that's fair.
Yeah, I mean, I know quite a few doctors. Some have gone through residency, some haven't. I can tell you that Aspen does our best to try to provide you with as much CE stuff that we can get you. We have different orientation programs for our doctors as well as continuing on, and we're developing new courses all the time. So yeah, I can't really speak to residency stuff. I've never experienced it, but I've seen doctors that come out of residency super strong and ambitious and ready to go. But I've also seen a lot of fantastic, regular grads come through and just take it on and just drive it home. So it's really I think it's based on your internal personality, I guess, would be my answer to that.
And like Jennifer said, we do have so many training programs right when you start, right off the bat. Well, right now with COVID, it's all virtual, but a lot of virtual training. You have, if you're an associate, there's your MCD, the lead dentist in the office that's going to help support you. And then things are changing a little bit, but we've had, like, after your 6 months of being here, we send you out and you get to meet with fellow dentists that started when you had, and you guys get to kind of be in like a town hall meeting. You gain CEs, but you just get to meet other people and have open discussions on your struggles and what you guys can do to improve. So it's a lot of support. And I feel like a lot of doctors don't really have to worry about CEs since we provide so many. But if there is, have you ever had that situation, Dr. Teskey, where someone wants to do a CE course that's not provided by Aspen?
No, I mean, they'll usually say, I want to do CE on this certain item or subject. And then I get, the support center to give us a list of the courses or whatnot. And usually that's enough. Or, if they want CE on endo, I say nothing's better than hands-on. Let's get some endo cases in and I'll work with you side by side. So, that really is our CE, because like dentists learn by doing things, and a lot of those general dentist courses are not hands-on, or they're, on a fake plastic tooth. So, Aspen has enough of a patient base and enough variety where if you want to do more endo, treatment plan it, get it accepted, and we'll sit down and we'll do it together. Or, do the book work, do the CE course that Aspen provides, and then we can do it. And it's just as good, if not better, for sure. So that's usually how I treat that. I can't think of any person that's wanted to do something where we haven't had an option for them.
That's awesome.
Yeah. I mean, I know in Wisconsin we're trying hard to find an endodontist to join our team, but in Michigan we had a traveling endodontist, and I did have some associates that wanted to better understand root canals, and we freed up their time in their schedule so they could travel with the endodontist for a day just to see an expert doing it. And we have 3 oral surgeons here in Wisconsin that travel our state. So I'm assuming that we'd be able to do that if somebody wanted to see an oral surgeon in action. But from my perspective, from the other states that I've been in, I haven't been opposed to it here in Wisconsin, but I've had doctors where they're just really adamant that they go to a CE course, that's something that we didn't provide, and that's okay. Our job is to support you as a dentist, and so we're going to clear up your schedule and find a way to make it happen.
That's awesome. Going along with that, so we do have specialty in the offices. How exactly does that work? What specialty do we have? And yeah, you said not in Wisconsin when it comes to endo, but in some states.
Well, we have 3 here in Wisconsin. We have 3 oral surgeons. I think every state in Aspen has at least 1 oral surgeon. We are working on endodontists joining our team as well, and we have several throughout Aspen Nation. We also have ortho. You in the office get to do the ortho through clear aligner therapy, but we have an orthodontist, Dr. Galante, on staff that helps double check all of our cases, and she's got a team underneath her. So yeah, to answer your question, we do a specialty. It's just whether or not you prescribe it. And I know Dr. Teskey, her oral surgeon, we're working on doing some virtual sessions with our oral surgeon and our doctors in the office so that they could better understand each other's treatment plans, because that oral surgeon is working off your treatment plan. And two is want to make sure everybody's on the same page and you get to talk to him and understand what his specifics are as well. So I don't know, Dr. Teskey, if you want to piggyback off any of the specialty stuff.
Yeah, I mean, don't get me wrong. Whenever I have an office, I get to know specialists around the office as well. I mean, guys, we refer out too. Our oral surgeon, he comes once a month and sometimes twice if he can, but he's got that nice cushy job that he works like 3 days a month or 4 days a month, and then he goes and plays with his horses the rest of the time.
That's
so
why
I
we
mean,
have 3.
But I mean, there's a time where somebody comes in the day after the oral surgeon was there and they're in pain and they need to be sedated or whatever it is, and they can't wait a month. So you send them to the oral surgeon down the road. It's totally fine. We're not going to get upset by that by any means. Most of my doctors don't do molar endo, if any endo, so they refer them to the endodontist down the street. Orthodontist, if you have a case that's just clear aligner therapy can't help, and there are plenty, send them to the orthodontist. Like, I always joke around, the orthodontist, every time I buy an office, one of them pops up right by it too, because I send ortho so much. So, we've got relationships with our specialists. It's not like we're locked in to only doing what we do at Aspen. Our specialists love us. They make sure to send us lots of cookies and treats and sometimes alcohol. If they are really nice to you, you will get a box every month from your specialists.
Oh, it's great. Going along with, certain procedures, do you do all your procedures? If some associate or MCD doesn't want to do certain procedures, how does that work?
So most of my doctors want to do almost everything. I probably restrict them a little bit until I know that they can do it confidently. Um, and by that, I mean implants, we run a certain amount of CE that you have to do, and then you have to place a certain amount or restore a certain amount before you can place. And then we send you to a placing course, and then we place them together. So I just want to make sure what you're doing is good work. But I mean, you can find somebody in your little area that's going to do it. If you don't want to do it, maybe the office 15 minutes away is going to do it, or vice versa. I have a doctor that loves taking out thirds. I don't like taking out thirds, so I send it to him 2 offices away. Patients love it. So again, I don't do molar endo, but I have one doctor that loves molar endo, the only doctor I have that loves molar endo, and he'll do it. You know what I mean? So it's fine. Or if he doesn't want to do it, if he thinks it's I send him the x-ray. If he doesn't want to do it, if it's too challenging, we refer it. So it's just a matter of asking, hey, do you want to do this? No, or yes.
Yeah.
And going from there.
It's a huge
Absolutely.
team effort. Even with you being the owner, you refer to your MCD or associate that feels really great or comfortable with it.
Yeah, a lot of my dentists, they're like, I would crown that. I'm like, I wouldn't. So I'll pull it if you don't want to do a crown, or if the patient doesn't want to do a crown, or vice versa. Same thing. It's like, this patient wants this. I don't think I can execute that. Is this a good idea to even send it to a different doctor? And we have those conversations too. So, yeah, absolutely.
Oh, that's great. I guess for the both of you, geographically speaking, did you wind up working somewhere you wanted? Did you have to move? I know, Dr. Teskey, you went to Marquette. Are you from Wisconsin originally? You are.
I grew up about 15 minutes north of Madison. So went to school at UW Milwaukee, went to Marquette, met my husband in Milwaukee. That's where his family is. That's where we just started working, and then it happened. And then Madison came along, and that's my hometown, and I wanted that to have just a piece of my hometown. So I make the hour drive. It's super easy for me, but yep, it's definitely where I wanted. I didn't have to go anywhere.
Great. That's really great.
Yeah.
But
we've had doctors, right?
Yeah, we have doctors that, I think the biggest thing with Aspen, it really depends on what you want to do. No matter if you're a doctor or you're a support person or you work at the administrative side. I've never personally moved anywhere that I didn't want to go. I moved because I wanted my own personal growth and growing with this organization. But I've never been forced to move anywhere that I didn't want to go. In fact, what we do for people, dentists included, if there is somewhere there you want to be and we have an office, if you are a solid employee and you're doing a fantastic job, like, why wouldn't we want to send you there? We want our good people to go where they're happy, because that means they're going to stay longer and take care of our patients. So everybody has the opportunity to transfer somewhere they want to be if they aren't where they want to be.
Except Florida. Florida's really hard to get to.
Yeah, Miami,
like a waiting list.
I'm sure Miami and I don't know, or else Chicago or something. Everyone wants to be.
Yeah, I was just joking with an owner this last week. She goes, Dr. Judge, you wouldn't let me go to Florida. You made me stay in Missouri. And he's like, what? I did. And she was joking. It was just a big joke. So not Florida. Just not Florida.
Good luck with Florida. Good luck. I guess talking about Florida and COVID aren't doing so well. Someone posed a question about, I've heard that DSOs had to lay off or furlough with COVID. How did COVID impact you and dentistry?
I think it obviously, we saw it coming a little bit. Definitely Bob and his team were we're monitoring that closely. We closed offices. I closed 3 out of my 5, mainly because we didn't have the PPE. So it wasn't for long, but when we got the PPE, the proper PPE, we started to slowly open back up. Aspen handled the whole COVID outbreak better than any place, and we're back stronger than ever. Jen, you're just dying to talk about this because we're really proud of how we handled it. I know we did a ton of stuff during COVID that I can't say enough about, so I'll let Jen do it.
Yeah, you know, we did have to furlough some people throughout our entire organization, but we were quickly able to move everybody back into an active role very quickly. So that's where I just feel blessed to be part of an organization that saw the pandemic coming, started prepping and planning and preparing for it. But we have all these great contracts with all these vendors that we have, and we're more prepared today than we were back then. So even if another crisis should hit us, we've been through it. We persevered through it. Not only with COVID, but any crisis that our country has ever had since Aspen's been here, we find a way to overcome it. And I've been here long enough to know that we've had a couple different things hit us. But we come back stronger every single time. In the state of Wisconsin, we did have to close for a couple weeks. Some of our offices stayed closed for about a month and a half. But again, we opened them all back up, brought all of our team members back, and got it going. So I just a great thing with our team. And as well as during that furlough period, we kept learning sites open for all of our team members, doctors, hygienists, dental assistants, front desk. Everybody had the opportunity to continue to learn and stay in touch and in tune with what was going on. Bob, our president, CEO, as well as Lori, everybody on the team really stepped up and highly communicated very frequently with all of the changes that were happening. So a lot of communication around it.
Great. Yeah. We also are, I don't think there was ever do you guys have a PPE shortage now? You guys are good with supplies?
Not anymore.
Yeah.
Yeah, no, we're good. We're solid.
Yeah. So we are, if those of you that don't know, we are the second largest purchaser or consumer of PPE next to the US government, because we have such a great relationship with Henry Schein, because we are so big, because we have all the resources. So it's really amazing to be part of such an organization that can be there for these kind of situations where, I mean, you wouldn't even think of something like this happening. So it's really great. Did you guys have to do teledentistry? Did that occur, or just?
We did. A couple of my doctors did it for me. I didn't want anything to do with it, but a couple of my doctors did. So they were like, I want it, I'll do it. And I said, please do, go for it.
Yeah.
Yeah. So we have the training for it. It's something that's a wave of the future. So we'll be prepared for that when it gets more broad stream, but we're ready whenever it needs to happen.
Wonderful. So what do your offices look like now during this time with COVID? Are patients coming in less frequently? Do they feel less safe? Do they feel as safe? Are they waiting outside? How is this whole thing changed, the process, procedures of things?
We definitely limit the amount of patients in the waiting room, or there's not as many waiting room chairs. Some of the offices where they're in more of a outbreak, they've got the plexiglass up, at the front desk. But, our doctors are full PPE as they need to, based on the procedure, aerosols, non-aerosols, so on and so forth. We have everything we need. Everybody's wearing masks. Jen, we're wiping stuff down every hour as best we can. There's not a lot of pens to be stolen anymore because they're all kind of hiding, so we don't have to wipe them down all the time. But Jen can talk more about that.
Yeah, we have safety protocols in place that the office team has gone through specific training for, as well as all new hires have to go through that safety training as well. And then the team that works underneath me, my regional managers, as they travel to all the offices, they're going to inspect that those things are being followed on a daily basis. And we have a lot of team members that take it to heart. So it's not too hard to stay compliant with something like this when our teams understand the importance of it. So everybody wears a mask. We have it available for patients too. In the event that they do show up without, the proper PPE for themselves, we'll provide it to the patient. We don't want to create any additional barriers. Employees have safety checks every morning with temperature checks and symptom logs. Same thing for our patients. They go through the safety logs as well. Temperature checks with a rinse that they do before going back into the operatories to really try to make sure that all things are done properly, to make sure everybody, patient and yourself as a dentist and your entire team, are safe as well.
That's amazing.
And paperless check-ins.
True. Yes, we do now have paperless check-in.
Wonderful, wonderful. So, Doc, did you feel overwhelmed by any of this, or did Aspen step in, like with the whole plexiglass barrier? Like, how did that all work, the organization of it?
I think if you weren't overwhelmed with it, that was weird. I mean, that was it was a lot.
Yeah.
But again, the beauty of Aspen is that we had phone calls twice, sometimes 3 times a week from Bob, reassuring us, telling us what they're doing, going over everything. And he would go through how they're securing PPE, and he would really say, okay, this is where we're at, and compared to the rest of the dental world and the ADA, we're ahead of the game. We're not, we're doing a great job. I could pick up the phone and call Dr. Judge and be like, Dr. Judge, I'm really stressing out today. And he would talk us through it. Everybody really came together on every single level. I could call anybody I needed to call, and they would pick up the phone and they would listen to me. Even if it was in an overwhelming, neurotic, oh my God, I've got COVID, I'm sniffling type of a thing. You know what I mean? But they were there for us, and they listened to us. And I think that was really important to actually know that they were there for us, to make sure that we didn't lose our minds through it, because it was very stressful. And that was just really heartwarming to be able to do that.
That's great. This is a little bit of a fun, but not, it's related to COVID, but not really. If COVID didn't happen, what would your summer have looked like? Or what will be the first thing you do when you have full freedom?
Oh, man.
Vacation.
Vacation, yeah. I think our summer would have been, I would have recruited a little bit sooner. Our summer would have been really busy though. We were supposed to have one of the biggest years of forever, right, Jen? And then it all came crashing down. So everything kind of got just put on hold. We were kind of set up to do this big hiring blitz and hiring more doctors and growing the practices. And then it came to a screeching halt. So now we're back to that. It just feels like we're at where we should have been at in March, but we're just doing it now. So we're almost back to normal. We're doing it smarter. But yeah, I'll take a vacation for sure.
I will say, things did come to a halt when COVID happened, but the state of Wisconsin's already 93% back to where we were before COVID hit. So by the end of this month, we're going to be back right on track to where we would have been. So you can imagine we're really busy right now. Once we were able to open our doors back up, it just exploded for us, and our demand's never been stronger. And that's not just for Wisconsin, it's our entire organization. So again, very blessed to be part of a community like this and a practice like this. But yeah, vacation would be really nice.
Where? Destinations?
Wherever my phone doesn't work. Maybe in the mountains somewhere.
Anywhere.
Wonderful.
Somewhere I do not get internet.
Wonderful. Well, I just wanted to thank you both. Did you guys want to add anything else? Any closing remarks before we end this session? If not, that's okay.
I mean, I'm always open if anybody wants to reach out with more questions or emails or texts. I can give Rubina the information, and I'm here to answer any questions if you guys think of something later or you want to get in touch. I'll get that information to you. Maybe we can actually speak live and in person someday here.
Right.
Yeah, same. Any business questions about who Aspen is or what my team would do to support you, or if there's any potential myths out there that you want debusted, feel free to call me. Yeah, I'm an open book.
Wonderful. Yeah, I feel like all of us are at Aspen are pretty open books. We want to let you guys know everything as honestly as possible. So I want to thank you both. Thank you so much for taking time out of your evening to do this. I know those that were watching really appreciate it, and those that will tune in later, since this will be posted, will be very, very appreciative for all of this information you've provided. Like Dr. Tetsy said and Jennifer had said, we can get in touch with the both of them. You guys all have my contact information, and we can arrange whatever it is that you need, if it's a phone call, shadowing, things like that. But we are here to support you and educate you as much as possible on Aspen Dental. So thank you, everyone. Have a good evening.
Thank
Bye.
you.
Thank you.
Bye.
Bye.